are for me?
Yeah, my name is Leaf Green, and I was born August 14th, 1960.
Okay, perfect, and that's what I see here. Do you have any allergies?
No.
I'm going to be doing a thorough head to toe assessment. I'm going to start at the head end of the toes and just review all of your body parts. And do you know where you are right now?
Hospital.
Perfect. And do you know how you got here?
Car.
And do you know why you're here?
Bursitis.
Okay. And do you have any pain today?
Yeah.
Can you describe that pain for me?
Burning.
Burning pain. And then when did that pain start?
2 hours ago.
And where's the pain located?
My bursa right here.
Okay. And then is that a constant pain, intermittent pain?
Constant.
And is it a burning, aching, tenderness?
Burning. Tender.
Okay. And then is there anything that makes it better, like Tylenol, ice, hot?
Not really.
Okay. And then what makes it worse? Walking around?
Walking around.
Okay. And is there anything related to that pain? When you have that pain, is there anything else that hurts?
No.
Okay. And then can you rate your pain on a scale of 0 to 10?
8.
8. Okay, well, when we're done here, I'm going to get you some medications and see if there's anything ordered to relieve that pain for you, okay?
Thank you.
And now I'm going to just look at the back of your head, and it looks good. I'm just checking for any skin breakdown and also behind the ears, and that looks good. In the face, making sure there's no lumps, swelling, or bruises, and I'll check inside your mouth and look at the pink oral mucosa, and that looks moist, intact, and pink. And I'm going to take a look at the chest and look at the skin on the chest. And I'd be checking for skin turgor here, and the skin looks good.
Thank you.
And I'm going to listen to the apical pulse for 1 full minute. And that sounds good. And then I would go ahead and start listening to lung sounds in an S-shaped pattern. And that sounds good. And I'll go ahead to also listen to bowel sounds, going from the left lower quadrant, left upper quadrant, right upper, and left lower. And I would do that for a full 5 minutes or until I hear sounds. And then I am going to look at the arms here. And then I'm going to check for any swelling or distension of the lower abdomen. Bless you.
Thank you.
And I'm going to check the arms here and see if there's any checks for skin turgor, check for any edema, and then I'm going to check bilaterally, see if they look equal. I'm going to check bilateral pulses, and then capillary refill. Can you squeeze your hands for me? Or my hands, sorry. Perfect, and then hand strength is good. And do you have any numbness or tingling in your hands?
No.
Okay, awesome, so that's good. At this point, I would wash my hands and put on gloves, and I would check the peri area, make sure that the labia looks clean, dry, and intact. And then I would wash my hands again, take my gloves off, and check the lower legs. I'm just checking that the legs are bilateral, no swelling or edema, and I would check pedal pulses and capillary refill. And can you push up on your feet for me? Perfect, and then push down. And leg strength is good. And do you have any numbness or tingling in your feet?
No.
Okay, perfect. And then I'm gonna check the neck for any vein distension, and that looks normal. And I would have the patient sitting at a 45-degree angle. And then I would have you roll over for me. And then I'm just gonna look at the back and check lung sounds on the back in an S-shaped pattern, and that sounds good. And I would check the coccyx for any skin breakdown in the back as well, and looking at the skin and checking the bud and making sure everything's clean, dry, and intact, and checking the back of the legs and the heels for any skin breakdown as well. And then I can take a better look at the head, and then I can have you roll back. I'm done with my assessment here. Is there anything I can do for you?
Can I have some water?
Sure, I'll grab you some water.
Thank you.
And I'm going to document this and wash my hands and step out, make sure that the patient's bed is in the lowest position. I would also ask the patient how they ambulate to the bathroom, but she's drinking water. And
I just walked there.
okay, perfect. And yeah, I'll step out.